Hi, my name's Bonnie. I have a lot of curiosity and a lot of questions around fertility and issues of female reproduction. I'm here joined with Dr. Angela Fingler. And Dr. Fingler is a doctor of traditional Chinese medicine, and her specialization is in fertility and women's gynecological problems. So, Dr. Fingler, can you tell me a little bit about the issue of recurrent miscarriage? When does it move from being simply a miscarriage and move into this classification as recurrent?
Okay. Well, miscarriages are very common. Up to 28% of all pregnancies end in miscarriage. But when it starts to move into recurrent is when I consider is when you have 2, and then Western medicine, they consider it when you have 3, and that's when they will refer on for testing. Generally though, if you've had 1 or 2, you don't really want to be having that 3rd. So I would recommend doing something about it and doing some treatment before then so that you don't go to that 3rd miscarriage. Sometimes if it's genetic, then you need to get genetic testing done for that. Most of the time in my practice, it's not genetic.
So how would you approach treatment then if a woman came in with 1 or 2 or even 3 miscarriages?
Well, first we want to see what's going on underneath. So we do an in-depth diagnosis, a history, and then I do what's called a Chinese medicine diagnosis. So we'll really look at what's going on with blood levels, hormone levels, energy levels, digestion, headaches, sleeping patterns, all that kind of stuff. So we get a pattern of what's going on with her overall health. Now with recurrent miscarriage, it's very important to strengthen the overall health before you get pregnant again. This is paramount. The idea is if you want to build a house, you need a strong foundation. So especially for having a healthy baby, you really want a strong foundation for that.
Well, I would admit most women who've had a miscarriage may be eager to get pregnant and start again. So what time period are we talking about here?
That's the biggest problem I face, is getting women to slow down and take that time. Generally, you're looking at around 2 to 3 months, maybe a little bit more if your problems are more deep-seated, maybe a little bit less if it's just a matter of fixing up a couple key things that need to be looked at.
What sort of things might be a common factor in this?
Autoimmune problems, undiagnosed hypothyroid issues or hyperthyroid issues, blood flow issues, digestive issues that are causing autoimmune problems. Those are just a few of the more common ones I see. When we get into the Chinese diagnosis, it can also tend to be running too hot, uterus tends to be too cold, therefore making the environment slightly hostile to conception and continuing the pregnancy.
All right, so what sort of treatments do you offer that would address some of those things? How do you approach that?
I use a combination because it has to be approached at a multi-pronged level. So 1, you're going to work on diet. 2, you're going to work on activity levels, too much or not enough. And then acupuncture and herbs. The acupuncture is really good for correcting imbalances in the body, especially to do with blood flow and nervous system. And the herbs are good at correcting underlying weaknesses and deficiencies. So we kind of take it at a couple different approaches and go forward from there.
So a few months, take care of this, set a foundation.
It's worth it in the end because the end goal is to have a healthy baby, not necessarily just another pregnancy. And the healthier you are going into the pregnancy and during the pregnancy, the better the baby's going to be. There's a lot of research into epigenetics that show how important that in utero time is. It will dictate the future health of your baby for up to decades in the future. So it's really important that you do that work beforehand, not just to get and stay pregnant, but for the future health of your baby.
90 days versus 30 years. It's a good investment of time.
Yeah, it is actually.
Yeah. So if a person's looking for more information or wanted to come in for consults or a diagnosis,
then they would go to our website, acupuncturehealthcalgary.com, or call our office, 403-253-3103. We're located in South Calgary, Bonaventure, beautiful Bonaventure.
It's a nice drive down here.
Great, as long as it's not rush hour.
Well, thank you very much, Dr. Angela Fingler, for joining me and for answering some of my questions. I thought if I was curious, you might be as well. So I hope you're enjoying the series.
Thank you.